Good afternoon, dear students. We have time for the last lecture for muscular system today. My name is Professor Dmitry Starchik. As usual, I'm going to spend next 1 hour and a half with you, and I'd like to check every student today, but now I see only 5% listening to my lecture. It is a little bit strange for me, because as far as I know, you come here for studying medicine, and there are 3 student group in the first course of the facility of the your choice. And please, maybe I like not only to put your name here in the textbook of our lecture, but I'd like also to ask your teacher to check your summary, what you wrote during your lecture, and what you got during your lecture. And it will be better, and I hope it helps me to better understand your feedback. Okay, today we are going to talk about limb muscles, and as usual, I want to ask you about quality of our translation. Please let me know if everything is correct with the internet connection. Today lecture is the last lecture in the musculorum system, and we will discuss the limb muscles. I didn't summary. Summary is a text what students usually write in the student book, and this is some notice, some information you get during the lecture, and then I'm going to ask your teacher to check what you write in human anatomy course lecture. As far as I see, you hear me clearly, so let me come to the studying material. So you see, this is very athletic guy who has strong limb muscles, and this is our topic today. And limb muscles are the organs. Limbs are organs. They help us to move, not only us, but for animals. For animals, they help animals to move on the surface, the land surface, and for humans, especially upper limb is a product of development. This is an evolution product which helps people to walk. There are 6 issues today. We will start from the discussing about difference between upper and lower extremities, and then under discussion will be development, phylogeny and ontogeny of extremity, and then we will study muscles, fascia and topographic formation upper limb first, and then we will come to all those structure, I mean topographic formation, muscles and fascia of the lower limb. And this is a very good picture, and you see here upper limbs, human upper limbs. I hope you recognize very famous picture, Creation of Adam, by Michelangelo Buonarroti, and this is also arms in the sketch of made by Leonardo da Vinci. He was very famous artist and engineer and scientist in Italy. And I demonstrate all of this picture just to say that the upper limbs of in our body have very specific function. Hands help us in our work. They are used for gestures. This is a special movements of the hands, which help people to show more emotions. And of course, and that is visible on this picture, hands are very beautiful. Some of picture show working arms or working hands, and it is visible that sometimes doctors can understand and can recognize what job the patient has. Just look at his or her hands. Philogenesis of the limbs visible in this picture, this slide. In evolution, limbs were formed with the advent of animals to the land. That is just moment, sorry. Владимир Александрович, да, здравствуйте, лекцию читаю, могу перезвонить. У меня документы есть, если быстро, то могу, завтра могу заехать или там. Ой, слушайте, отлично. Мы готовы принять все, что вы нам дадите. Да. Да. Я говорю, готовы принимать все, что дадите. Хорошо, спасибо большое, Владимир Александрович. Мы готовимся к приему, я передам нашим. Спасибо большое. До свидания. Sorry. So, as I said before, limbs are products of the movement animals to the land. When they advent to the land, it is the time when animals started to formation of limbs. And animals, in difference with the human, have front and hind limbs. People has upper limb and lower limb. And skeleton of the upper and lower limbs in animals are similar. And you see, this is visible, that no big difference between front and hind limbs in animals. Because they have the same function, and this function we call locomotion. It means movement. Millions of years later, our ancestor, that is the animals which give us it was the pre-human animals. Of course, they were monkey or primates, and primates began to use only the lower limb for movement, and the upper limb were freed for the labor, for the work, in other words. So, upper limb is a product of evolution, and this is the organs which help us to walk. The hind limb of primates, of monkey, becoming lower limbs, took on the entire weight of the body, while primates were standing and walking. So the foot, you see here, this part of the body we call foot, lost the ability to grip. The toes shortened, the toes is the first especially this is the finger, but not in the hand, but in the foot, and the toes shortened. They were, let me demonstrate it. Firstly, it was such longer, and then it became shorter, like you see here. And the toes drew closer, so you see no gap between toes, and that is the product of evolution. That is the result of the evolution. And it is very important for humans, the foots became arched. This is the shape of the foot. It is not, it's visible that the bones are organized like arch. It is not flat. It is arched, because it helps people to stand vertically and move only with the support of the lower limb. So that is very important organization of our foot. This is the features we call homologous features. That is the similar features of the upper and lower extremities in humans. First of all, upper and lower limbs. Алло? Да. Да, все хорошо у него. Спасибо. Угу. Upper and lower limbs, girdles. This is the central or proximal parts of the limbs are similar. Upper limb and lower limb have free section with the three segment. I mean this and these parts have the same equal three segments. Here, three segments of the upper limb and equal three segments of the lower limb. And we called this first segment of the upper limb as a shoulder, then forearm, and then hand. In lower limb we have tight, this is massive part of the lower limb, leg, this is leg, and foot, what is equal to the hand. And very interesting fact that muscles of the extremity form up to 82% of the entire musculature of the body. It means it is quite big and massive structures in locomotion system. And next slide demonstrates differences between upper and lower limbs. First of all, upper limbs is organ of labor activity. As I told you before, that is a product of labor. Hello? And upper limbs consist of dexterous and dynamic muscles. That means they produce high speed, but they can work shorter time, not such long time as lower limb. Regarding lower limb, they performs the locomotor function. So they produce locomotion, and people who get massive lower limb muscles, they can run very, very fast, because this is the organs of locomotion in comparison with the upper limb. Lower limb have predominantly strong and static muscles. What does it mean? That means that these muscles produce they are force, they have very strong, really strong. So they work as a force lever. You see here two levers. Here is a speed lever for upper limb skeleton and muscles, but you see the force level in lower limb structure, locomotive structure. And in summary, I'd like to share you the difference of the upper and lower limb in this list or table containing 4 main differences. First of all, upper limb is a tool of labor. We use upper limb as organ of gesturing and balancing. Sometimes, and that is true, upper limbs support our body, especially in children, old people, and patients. Joints of the upper limb work in a differentiated manner. They have a lot of different movements, very exactive, very this is the muscles usually people use for small job, small activity like painting, like surgical operation, and Joints and muscles of the upper limb help us to walk in a very, very differentiated manner. And it is important difference. Maybe you remember this difference from our lecture of limb joints. That is the shoulder joints very mobile in comparison with the lower limb pelvic girdle. I hope you understand that a lower limb ensures an upright position when we stand vertically, and they help us to move our body. Foot has arches. Joints of the foot are less differentiated, and I hope you understand that it is easy to play piano with hands, but it is not easy to play piano with the foot, because the differentiation of the joints are not similar. They have quite visible differences. Okay. Differences. Another difference in upper and lower limb consists in the fact that upper limb have only 28% weight percent of the whole body muscle weight, but lower limb has 56%. It means that lower limb muscles is two times bigger and massive than upper limb muscles. Different muscle groups it is typical for upper limb, especially in the forearm. For the shoulder, if we will compare shoulder with the thigh, we will find three group of muscles in thigh, but only two group of muscles. But if we take a look at forearm, we will find here more muscles and more layers of muscles, because forearm muscles help us to walk very precisely. So, and tendons of the hand are located longitudinally, no flex between forearm and hand. But in the lower limb, we see that muscles have almost right angle. So this is, we find angle between each group of leg muscles. Interesting fact is that on the upper limb we find mostly flexors, and they are stronger. But in the lower limb, usually extensors are stronger than flexors. Development. Development of the limb we will see in 5-week-old embryo. This is the two small limb buds, we call it limb buds. And this is limb buds developed from ventral part of myotomes. This is myotomes, and limbs and their muscles are product of ventral myotomes. Upper limb developed are developed from cervicothoracic myotomes. This is this part of myotomes, but lower limbs are product of lumbosacral myotomes. And then you see how different group of muscles were formed from different part of ventral myotomes. You see different muscles. That is a 8-week-old embryo, and all group of muscles, mostly in upper limb, but they also are visible in lower limb. And interesting fact is that lower limb has smaller size and are not such massive as they are in adult, because they have some delay in the development in comparison with the upper limb. Upper limb form earlier than lower limb, especially in embryo, during embryonal period of time. Now it's time to study muscles, fascia, and topographic formation of upper limb. Upper limb muscle classification is we distinguish 4 group of muscles in the upper limb. And the first group, алло, слушаю вас. По поводу чего? Это что вы везете? Спасибо большое, да, я понял. Хорошо, у нас все дома, вы доставите на Парголовский. Спасибо большое, да, мы вас ждем, спасибо. I'm sorry, this is the just take a short break. Sorry. Лена, приедет Амазон через полчаса. Хорошо будет готово к нему. Нет, наверное. Ну, на всякий случай. Диметра, помнишь? Ну, статуэтка, извините. Да, извини, лекцию читать там. So, the first group is muscles of the shoulder girdle. This is this group. The most popular muscles we call deltoid. Deltoid here. The second group is muscles of the shoulder or shoulder muscles. There's a two group. Anterior group we call extensors, and anterior group we call flexors. Here you see extensors, muscles named triceps, musculus triceps of Brachii or shoulder. The third group, that is the forearm muscles. This part is forearm, but you see the tender of forearm muscles come to hand, anteriorly and posteriorly. And the fourth group, this is the muscles of the hand. What kind of muscles, most famous muscles of the shoulder girdle I can demonstrate you today? This is the deltoid here. Subscapular here, supraspinatus, infraspinatus, and teres major and teres minor. Four muscles on the back surface of the scapula. And also here visible all of four muscles on the dorsal or posterior surface of the scapula. Here is supraspinatus muscles, here is infraspinatus, and musculus teres minor. Please notice that three of these muscles, they have destination on the major tuberculum major of the humerus. And usually these muscles rotate the shoulder counterclockwise, or rotate it or make external rotation. So these three muscles with the subscapular muscle we call rotator cuff, they rotate shoulder in internal direction or in external. Subscapularis rotate internal, but supraspinatus, infraspinatus, and teres minor rotate shoulder externally. Shoulder muscles, very famous. I think that is the most famous muscles is Biceps Brachii. It has got two heads, long. Here is a long head, but here this is a short head. And when we take off biceps, we can nicely see to another muscles of anterior group. This is, I show you now, called Coracobrachialis muscle, and this one is Brachialis. If biceps move upper limb in shoulder joint as well as in the cubital joint, but coracobrachial is one joint muscles. It flex shoulder in shoulder joint, but brachial is the flexor for cubital joint. In posterior group, we can nicely see this massive and very famous muscle called Triceps Brachii, and small muscles we could find here. This is anconus. Anterior forearm muscles consist of anterior and posterior groups. Each group has got two layers. Superficial layers, it is visible here, but also deep layer. These deep layer muscles are illustrated in this picture. Posterior group also has superficial layer here and deep layer as well. Muscles of the hand. If you take a look on your own hand, please do this right now, you see three groups of muscles. If you look at your right hand, you see a lateral group lateral group where muscle connected to the first finger, and we call this group of muscles tenor muscles, because tenor, that is the name of the first finger in our hand. The second group, and it is also visible in our hand, we call hypotenor muscles. Hypotenor, because they connect to the fifth digital, and these two groups are quite strong. Борис Евгеньевич, перезвоню. Да, спасибо. Да. But between tenor and hypotenor muscles, there is a middle group, and you see these lumbrical muscles. They are located superficially, but also you could find when you dissect superficial layer, you see under these muscles the interosseal muscles. Palmar, it means they are located anteriorly, and dorsal. All group of these muscles move fingers. Lumbrical muscles flex fingers in the metacarpal phalangeal joints here. We will see flex here. interosseous, palmar interosseous muscles to make abduction of the finger. They move them together and make them close. But dorsal interosseous muscles just produce abduction when finger have gaps between each fingers. Fascia of the upper limb usually each part of our body, every part of our body, and the upper limb is not exception. Here, where we don't see internal organs, and upper limb we don't see we don't see any internal organs. Such parts have usually two fascia, superficial and propria. Superficial fascia are located under the skin, but propria, fascia propria, it is Latin name also, abbreviation FP. Have different group which produce which cover different group of muscles. Shoulder girdle, special fascia of the shoulder, fascia of the forearm, and even fascia intrinsic, we call propria intrinsic fascia of the hand. Each part of the upper limb has personal or intrinsic fascia, which has a name, a Latin name, fascia propria. It means it's the same, our fascia. Topographic formation of the upper limb. Firstly, I'd like to demonstrate you the cavity. It is not cavity, sorry, this is a fossa, and we call it axillary fossa, which is a depression. Right term is depression in the skin. It is visible in humans without dissection and алло. Елена, извините, читаю лекцию, не могу разговаривать. Лекцию читаю, извините. So this is depression on the skin, which is visible in a live person, but we have also cavity, and it is called axillary cavity. In comparison with fossa, that is a real cavity between muscles of the shoulder girdle. And usually this cavity has got 4 walls anterior. Let me show it. This is the anterior wall. Then you see the posterior wall, medial wall located here. This is also muscle, and laterally. So this is a cube, some of like cube and cavity which consists filled with the fatty tissue. It also has blood vessels inside, nerves, and lymph nodules. Especially very important to know what kind of lymph and how many lymph nodes are located in axial cavity when we deal with the cancer of the breast in women. And the posterior wall of the axial cavity has got two topographic foramina. The first foramina, called quadrangular space, but second has name triangular space. They are really have the same shape. Here quadrangular and here is triangular. They contain nerves and some blood vessels, and usually you should know these topographic formations because they help surgeons to operate correctly and don't damage these very important nerves and vessels in two foramen, on two space. On the shoulder, we could find three topographic formations. Here you see a cut of the shoulder. This is the level of cutting, and you see two sulcus. Sulcus bicipital medialis with a lot of vessels and nerves. Sulcus bicipital lateralis, it is only one vein in this sulcus, and a very deep located Brachioradial Canal, because inside of this canal we could find radial nerve, sometimes with deep brachial artery. Forearm topographic. On the anterior surface of the cubital joints we find ulnar fossa, fossa ulnaris in Latin. It is the intermuscular space, usually between muscles of the shoulder and muscles of the forearm, and it consists some arterial structure like brachial artery, which is divided in two arteries of the forearm, radial and ulnar. And this place doctors use for intravene injection, because on the surface under the skin we very often can see the median vein of the cubitus. It is located in projection of ulnar fossa. Forearm topographic formation. There are three sulcus. Radial, number one, between two muscles. This is the first one, is named Brachioradial Muscles. Then we see superficial flexors, radial extensor, radial flexor of the forearm, and then the flexor digitorum superficial. This is the borders of sulcus number 2, we called sulcus medianus, and the most medially located sulcus we call it sulcus ulnaris, is located between musculus flexor digitorum superficialis, with Latin name, and musculus flexor carpi ulnaris. In the wrist area, we find very strong retinaculum flexorum. It is made from connective tissue, and under retinaculum flexorum we find large canalis carpi here. This is canalis carpi. We could also see canalis carpi radialis with 2 tendons of muscles, and canalis carpi ulnaris. So there are 3 carpal canal under retinaculum flexorum. I repeat again that this connective tissue structure is retinaculum flexorum, which is made of connective tissue. And 6 canals are located under retinaculum extensorum. This is another structure on the dorsal or posterior surface of the hand, and you see a lot of canals under this retinaculum extensorum. Each tendon of almost every tendon of the forearm muscles coming to the hand get the special covering we called synovial sheath. That is synovial sheath for the musculus flexor pollicis longi, and this is a common sheath for muscles flexorus digitorum, and it come to the digital number 5, but digital number 2, 3, and 4, they have no connection with the common synovial sheaths, but they have personal synovial sheaths on the anterior surface of the hand. You may ask me what is the function of this sheath. They reduce friction. They reduce the thermoproduction and reduce the pain when we move with hand and fingers, because we do it very often. So that is all sheaths help our hands to reduce friction. Lower limb muscles, fascia, and topographic formation. There are also 4 groups of muscles in our lower limb. First group, that is the muscles of the pelvic girdle. Then this is here. All of these muscles, almost all of these muscles are very strong and force. The second group is a tight muscle, that is here, tight muscles. Then muscles of leg and foot muscles. So there are also four groups as at upper limb. Muscle of pelvic girdle. They are internal muscles. Here you see psoas major, iliacus, and when they combine together here on the thigh, we call these muscles iliopsoas muscles. And the internal group also has musculus piriformis, and even one muscles located on the obturator foramen obturatorium. We called these muscles this muscle obturatorium internus muscle. Posterior part of the pelvis is the place where we find strong gluteus muscles. There are three gluteus muscles. Maximus, you see it here. This is a gluteus maximus. Then you see gluteus medius. It is cut here, but under gluteus medius you find gluteus minimus muscles. So there are three gluteus muscles here. Maximus, medius, and minimus. Anterior group it is interesting. Yes. Interior tight muscles have divided into three groups: anterior, medial, and posterior. You see strong group. Sorry, it's not correct. It's better. This group we called anterior group, and this group consists of the very long muscles called sertorius, and very strong muscles, it is here, quadriceps femoris. Sometimes we call these muscles muscle of a football player, because a football player has have very strong quadriceps, because they use football, they play football. Posterior group, this is the three muscles. Biceps, take notice that there is biceps, but it called femoris. It means this muscles is located on the thigh. Then you see semitendinosus muscles, and under previous muscles we could find semimembranosus. Semitendinosus and semimembranosus. It is the two muscles located medially on the posterior surface of the thigh. Next, medial group. This is the Pectineus, Abductor Brevis, Abductor Longus, Abductor Magnus, and longer and thin Musculus gracilis, or gracilis muscle. All of these muscles adduct tight to the median line, and they produce adduction, and they are quite strong. Leg muscles, three group we could find here. We could find three group of muscles in our legs. Anterior group have three. Lateral group has two muscles, but posterior group has force and strong triceps, or Triceps cruris, that's the correct name. Rudimental plantaris muscles, and three group muscles in deep layer. This is Flexor Digitorum longus, Flexor Hallux longus. Hallux is the first toe of the foot, and between them we distinguish tibialis posterior. That is it's between two previous muscles. Foot muscles. In comparison with the hand, we find, this is number 4. We have two groups, plantar group and dorsal group. There is no dorsal group in our hand, but at foots we could find two dorsal muscles here. The same idea is in construction of plantar group of the muscles. There is the part for muscles connected to the hallux. This is the hallux, or we call it medial group. There is also a lateral group, but intermediate group are stronger because it has two additional muscles in comparison with the hands. Lower limb fascia. Here we see two fascia, superficial under the skin, and propria or intrinsic fascia of the lower limb. Each region, gluteal region, tight leg and foot, have got different but similar in development, in origin fascia. This fascia, fascia propria or intrinsic fascia, they help muscles to move, and it is like septum, or the some kind of border between group muscles in different group. Very good picture. I hope you will do that very often when you get doctors. And this is the posterior surface of the pelvis, and usually only this part of the pelvis, pelvis muscles, we use for intramuscular injection, because there are no vessels and nerves in this lateral superior quadrant in the gluteal region. So if we divide gluteal region with the two lines, horizontal and vertical, the lateral and anterior quadrant is a good point to inject some medicaments, some pharmacological drugs, or drugs, I mean in medicine, not drugs. And topographic formation, pelvis topographic formation. Firstly, on the posterior surface, we see two opening. We call them foramen. This is foramen infrapiriformis. Infrapiriformis means piriform means these muscles, and under these muscles we find foramen infrapiriformis. But between pelvis bone and piriform, we could also see foramen suprapiriform, suprapiriform foramen. The first and the second piriform, this is a place where we find different vessels and nerves. So this is the sense of topographic formation. They contain different arteries, veins, and nerves. In order, surgeons can be oriented and find these vessels and nerves in such topographic formation. So this information is very important for you if you are going to be surgeons. Tight topographic formation is the place between inguinal ligament inguinal. Here you see a projection of inguinal ligament, and under this ligament, but located laterally, we find musculorum lacune, or lacuna musculorum in Latin. But in medial part, we find lacuna vasorum. What is the difference between lacuna? They are divided by special connective tissue. We called it septum ligamentum iliopectinum, and this muscular lacune contained musculus iliopsoas and nerve, femoral nerve. But vasorum lacune, it calls that because it contains femoral artery here and femoral vein here. So this is vasorum means vessels. So lacuna vasorum, it might be called lacuna of the vessels. It's really contained femoral artery and vein, and also small but interesting lymph node with name of Great Pirogov. It's Professor Pirogov, famous anatomist and surgeon in 19th century. And Obturator Canal. This is a small gap in muscles of the pelvis, and it also contains artery, triad, artery plus vein and nerve. So they come to medial group of the tight muscles and innervate and bring blood. It provides blood circulation in the medial group of muscles. Femoral canal, canalis femoralis. This is a pathological gap between in the vascular lacuna, and we only find this gap when form femoral hernias. This is a pathological situation when the femoral hernias were formed, and usually this pathology is typical for women, not for men, thanks God, and but it needs surgical operation because it is danger to use femoral hernias without operation. Tight topographic formation, the famous triangle on the tight we call femoral triangle, and it is between tight muscles. You see its borders, and as all topographic formation, it is necessary mostly for surgeons. Leg topographic foramen. This is of course canalis adductorius, because it it produced by adductor muscles, and inside you see artery and vessels, artery and vein, femoral artery and vein, and it is a way from the tight to the popliteal fossa, because the vessels come here from the tight during through the Abductor canal. This is a popliteal fossa, is a rhomboid shape depression between muscles, and this is a place or area where localized nerves, large nerves, large veins, and large artery, and these artery and veins send blood to the knee joint and take back the blood with low concentration of the oxygen. In the leg, we find one long canal called Canalis cruropopliteus, or named after Gruber. Gruber was the doctor who worked with Pirogov in the Military Medical Academy in St. Petersburg, and he gave. He was first who gave description, who described this canal. So now we call this canal Gruber's canal. And as usual, as other topographic formation, it contains artery and veins and tibial nerve. Here, two topographic formation of the foot, two of sulcus, lateral and medial, and they are between three group of plantar muscles and contains arteries and nerves as well. A couple of words in the last slide of our lecture. This is anomalies of lower limb. Sometimes embryon have no bugs, no limb bugs, and then embryon has a very small lengths of upper and lower limbs. Sometimes there is no foot, and this pathology, this anomaly called phocomelia. That is all for now, my friend. Thank you for your attention. I prepared the small test where you try to check yourself and I recommend before you start the test for limb muscles, please see what kind of muscles are located on the different part of the upper and lower limb, because all tests, today test, have questions regarding upper and lower limb muscles. Thank you for your attention. Hope to see you next week. There are two lectures we have in January, so I hope you will visit lecture and get new knowledge from there. Thank you for your attention. If you have no questions, see you next week on Monday. Goodbye.